All right, everyone, welcome back. Today, we're going to take a deep dive into something that affects so many of us, depression and anxiety.
Yeah, it's a really important topic.
Definitely. We've got some fascinating insights from the CDC, the Anxiety and Depression Association of America, the ADAA, and some really practical stuff from Healthline. But, just skimming through these sources, it really struck me how often depression and anxiety are treated as separate things. But they seem way more connected than I realized.
Oh, absolutely. It's more like two sides of the same coin, really. And, recent research has even started to uncover some of the actual physical connections in the brain between the two.
Really?
Yeah. Like, did you know certain brain regions, like the amygdala and hippocampus,
Yeah.
they actually play a key role in both?
Wow. No, I had no idea. So it's not just like a feeling, feeling down versus feeling stressed. There's actual physical stuff happening that links them.
Exactly. And it even goes beyond the brain. Think about the symptoms. Of course, there's the classic depression signs like persistent sadness and losing interest in things you used to love.
Right, right.
And then for anxiety, there's that excessive worry, feeling on edge all the time.
Yeah.
But then you've got the shared symptoms, and that's what really highlights the connection.
Okay, give me an example. Like what kind of shared symptoms?
Well, think about sleep. Both depression and anxiety can totally mess with your sleep, whether it's falling asleep, staying asleep, or even just waking up feeling exhausted.
Yeah, makes sense.
But then it gets worse because when you're sleep deprived, well, that makes your anxiety worse, and then that makes it even harder to sleep.
Ugh, yeah, it's like a vicious cycle.
It is. It's a total double whammy. And speaking of things that make both conditions worse, Healthline brought up this thing called rumination. Have you heard of that?
Yeah, I think so. Isn't it just like overthinking stuff,
Yeah.
getting stuck in those negative thought loops?
It is, but it's a little more nuanced than that. With anxiety, rumination tends to be all about worrying about future events, those what-if scenarios that can spiral out of control. But with depression, it's often more focused on the past, dwelling on mistakes or things you regret, like you're constantly beating yourself up over stuff.
So it's like getting stuck in a time warp, either replaying the past over and over or fast forwarding to the future and only seeing the worst possible outcome.
Exactly. And the thing is, rumination doesn't actually solve any problems. It just makes them worse. You just get more and more stuck in that negative headspace, and then you can't take action or find solutions. You're just paralyzed.
Wow, okay, so we've got depression and anxiety often showing up together. They're both fueled by this rumination thing.
Mhm.
But it doesn't stop there, right? The CDC also found a link between smoking and mental health.
Right. It's a connection that often gets overlooked, but the CDC was very clear about it. Smoking is way more common in people with mental health conditions, especially things like depression and anxiety.
Hmm.
Yeah. And get this, 3 out of every 10 cigarettes smoked in the U.S. smoked by people dealing with these conditions.
Wow, 3 out of 10. That's a lot.
Yeah.
It makes you wonder if people are, like, self-medicating, using cigarettes to try and cope with their symptoms.
Yeah, that's a really good question, and it's something researchers are still looking into. Some theories suggest that nicotine might, temporarily make some symptoms better, like anxiety or trouble concentrating.
Maybe.
But here's the key takeaway. The CDC really emphasized that smoking is not a solution.
Right.
In fact, they said quitting smoking can actually improve mental health.
Yeah, well, smoking is terrible for your physical health.
Mm.
And we all know that your physical and mental health are super connected.
Exactly. Plus, nicotine's a stimulant, so it can actually end up making anxiety even worse in the long run.
Makes sense. Yeah. Okay, so we've established that depression and anxiety are often like a package deal. They feed off of each other, they're made worse by rumination, and there's this unexpected link to smoking. But what's someone who's actually struggling with these conditions supposed to do? It feels kind of overwhelming, honestly.
I know, right? It's a lot to take in, but don't worry, there's hope. Healthline actually had some really practical tips that people can start using right away, even before they seek professional help.
No, that's good. I'm all ears. What are some things people can do, like right now, to start feeling better?
Well, first of all, just allow yourself to actually feel your emotions. I know it sounds counterintuitive, but when you try to ignore or push down those difficult feelings, it actually makes them stronger.
It's like that saying, what you resist persists.
Yes, exactly. And another powerful strategy is to focus on what you can control. Because when you're feeling super overwhelmed by anxiety or depression, it's so easy to feel powerless, like you're just a leaf in the wind.
Right, totally.
But even small actions like tidying up your space, taking a quick shower, or making a healthy meal can give you back a sense of control. You start to feel like you're actually accomplishing something.
It's like finding those little pockets of order in a world that feels really chaotic, right?
Exactly. And another thing that's really important is maintaining a routine. When your sleep schedule, your eating habits, and your activity levels are all over the place, well, it just makes anxiety and depression worse.
Yeah, I can see that.
So try to stick to a regular sleep-wake cycle, even on weekends. Eat balanced meals at regular times, and try to get some physical activity into your day, even if it's just a short walk.
Yeah, it's about creating that structure for your day, which can be really grounding when you're feeling emotionally shaky. Gives you that predictability.
You nailed it. And speaking of support, don't underestimate the power of your social network. Friends, family, even pets, having someone to talk to vent to, or even just to share a laugh with can make a world of difference. It reminds you that you're not alone.
It's like having a team of cheerleaders in your corner.
Exactly.
Okay, so we've talked about some things people can try on their own, but sometimes that's not enough.
Right. Yeah, sometimes you need a little extra support. And that's where professional treatment comes in.
Right.
There's absolutely no shame in talking to a therapist, a counselor, or a psychiatrist.
Yeah.
It's like going to the doctor when you have a physical problem.
Makes sense. If you're struggling, it's important to get professional help so you can get the right diagnosis and the right treatment plan.
Exactly. And speaking of treatment, there are actually a lot of different approaches that can be effective for both depression and anxiety. We'll definitely dive into those in more detail later. But for now, I want to emphasize that seeking professional help is a sign of strength, not weakness.
I love that. It takes courage to admit you need support and to take those steps towards healing. Now, I'm curious, before we move on to treatment options, have you ever come across a story in your work that really exemplifies this idea of seeking help and finding hope?
You know, one story from the CDC research really stuck with me. It's about a woman named Rebecca M. She was 57, and she had been dealing with both depression and smoking for a long time.
Oh, yeah. The link between smoking and mental health that we talked about earlier. I can imagine how tough it must have been for her to try and quit smoking while also dealing with depression.
It is a really difficult situation. And like we said, those two issues can become a vicious cycle. But what's so inspiring about Rebecca's story is that once she decided to get help for her depression, things started to change. Her therapist helped her develop some coping mechanisms for her depression, and as her mental health got better, she found she had more strength to tackle her smoking habit too.
That's incredible. So addressing her mental health had this ripple effect, creating positive change in other areas of her life.
Exactly. And it just shows that even when things feel hopeless, there's always a possibility for change and healing. You just have to take that first step.
It's a powerful message of hope. And it's the perfect lead-in to our deeper dive into treatment options and the road to recovery. All right, so we've talked about how depression and anxiety often show up together and how they can really impact our lives. But let's get practical here. What does treatment actually look like? What are people doing to actually deal with this stuff?
Well, therapy is usually a really important part of treatment. And you mentioned CBT earlier, which is cognitive behavioral therapy.
Yeah.
And it can be super effective. But what's interesting is that CBT isn't just one thing, you know?
Right.
Yeah. There are actually like different types of CBT, each one kind of tailored to specific needs.
Different, like, flavors of CBT.
Uh-huh.
Okay, I'm intrigued. Tell me more about these variations. What makes them different?
Sure. So there's one called mindfulness-based cognitive therapy, or MBCT for short.
MBCT.
And it basically combines the usual CBT techniques with mindfulness practices. It helps you become more aware of your thoughts and feelings, but without getting totally swept away by them.
So it's not about, like, trying to get rid of negative thoughts completely, but more about learning to change how you react to them.
Exactly. It's about observing those thoughts without judgment, like watching clouds float by.
Oh, I like that. That's a great visual.
Yeah.
And how is that different from other types of therapy, like, say, psychodynamic therapy? How do those two compare?
That's a great question. Psychodynamic therapy tends to dig a little deeper into your past. You know, it explores how your early relationships and experiences might be affecting you now, even subconsciously. But CBT, it's much more focused on the here and now, on what you're thinking and doing right now, and how to change those unhelpful patterns.
So it's like two different ways of looking at the same problem using different tools.
Precisely. And sometimes, you know, a combination of approaches might be the best option for someone.
Makes sense. It's not a one-size-fits-all thing. Okay, so we've talked about different therapy options, but what about medication? Where does that fit in?
Well, medication can be a really valuable tool, especially when symptoms are severe. You know, when they're so bad that it's hard to just function in everyday life.
Yes, totally.
Things like antidepressants and anti-anxiety meds can help to, like, regulate your brain chemistry, they can give you some relief from those really overwhelming feelings.
That's like giving your brain a chance to catch its breath, right? So you
Mm.
can actually start working on things in therapy and using those other coping strategies we talked about.
Exactly. It's not about just masking the problem. It's about giving you the space and the ability to heal. And I think it's really important to remember that finding the right treatment plan is a partnership.
So working closely with a mental health professional, being open and honest about what you're going through, and really advocating for yourself, those are all super important parts of the process.
Oh, absolutely. It's about finding what works best for you. And that might mean trying different things, adjusting your medications, or even exploring some alternative
It's a
therapies.
journey, right? It's not like you just flip a switch and you're cured.
Exactly. It takes time and it takes work. And speaking of working together, we've been focusing a lot on those individual steps towards well being, but I keep thinking back to the importance of community.
Yeah, me too.
The ADA especially emphasized how crucial social support is. It seems like it's not just about what we do for ourselves, but also about the connections we build with others.
Totally. It's like that saying, it takes a village.
Exactly. Humans are social creatures. We need those connections. And when we have strong social support, it actually acts as a buffer against stress and loneliness.
That's like having a safety net,
Yeah.
knowing you're not alone in your struggles
Yep.
and that there are people you can lean on, people who truly understand what you're going through that can make all the difference.
It really can. And, speaking of reaching out for help, I think it's important to talk about self-advocacy.
Self-advocacy. Okay.
Yeah, it can be really tough, especially when you're feeling totally overwhelmed by depression or anxiety. To even think about advocating for yourself, it just seems impossible.
Yeah, it's like when you're barely functioning, the last thing you want to do is fight for your needs. It feels almost counterintuitive.
I get that. But it's so important to remember that you deserve good care. And sometimes getting that care means you have to speak up for yourself.
Okay, so how can people be better self-advocates, especially when it comes to mental health? What are some practical tips?
Well, first of all, just educate yourself about your condition. Learn about the different treatment options that are available.
Right.
Because the more you know, the more empowered you'll feel to make decisions about your own care.
It's like knowledge is power, especially when you're navigating something as complex as the healthcare system.
Exactly. And don't be afraid to ask questions during your appointments. If something doesn't feel right or you don't understand something your doctor or therapist says, just ask. They're there to help you.
It's about creating a partnership, working together as a team to reach your goals.
Exactly. And remember, you're allowed to get a second opinion if you want to, or to try different therapists until you find one who really gets you and who you feel comfortable with.
It's your journey. You have the right to choose what feels best for you.
I love that. And speaking of feeling good, I think it's really important to acknowledge all the work you've done in exploring this topic with me today. It's not easy to talk about these things.
Wow, you're right. We have covered a lot of ground. We started by understanding how connected depression and anxiety are. Then we dove into treatment options, everything from therapy and medication to those lifestyle changes, and the power of having a strong support system.
Right.
We even touched on things like gratitude, mindfulness, and spirituality.
It's been quite a deep dive. I really hope this whole conversation has left you feeling more informed, more empowered, and more hopeful.
Me too. And as we start to wrap things up, I want to leave you with one final thought. If you could go back in time and give one piece of advice to your younger self, about navigating life's ups and downs and really taking care of your mental well-being, what would it be?
Oh, wow. That's a really powerful question. It makes you think about all the lessons you've learned along the way. I think I'd tell my younger self to be kinder to herself, to accept her imperfections, and to remember that asking for help is not a sign of weakness, but actually a sign of strength.
I love that. That's such wise advice. And I think it's the perfect way to wrap up this part of our conversation. Remember, you are not alone in this. There are resources out there, people who care, and a whole world of possibilities waiting to be discovered. It's fascinating how everything we've discussed, from CBT and gratitude to even spirituality, all comes back to this idea of connecting, both with ourselves and something bigger. But I feel like we've only just scratched the surface when it comes to actual treatment options.
Yeah, there's so much to explore.
Earlier, we touched on therapy and medication. Can we unpack those a little more? What are some of the specifics?
Absolutely. We talked about cognitive behavioral therapy, CBT, and how it helps you, like, reframe those negative thoughts.
Right.
But what's cool about CBT is that it's often very structured.
Oh,
Yeah, you'll have specific exercises and even homework assignments to help you actually use those new skills in your everyday life.
so it's not just like lying on a couch and venting, hoping things will magically get better. There's actual work involved.
Haha, yeah. There's definitely effort involved,
Yeah.
but that's actually what makes it so effective. You're actively learning new ways of thinking and behaving, almost like rewiring your brain.
I love that, rewiring your brain for happiness. Okay, so that's CBT. What about medication? When is that usually recommended?
Medication can be really helpful, especially when symptoms are so severe that they're keeping you from, just living your life.
Right, when it's really debilitating.
Exactly. Antidepressants and anti-anxiety meds, they can help to kind of stabilize your mood and take the edge off those really overwhelming feelings of, anxiety or despair.
It's like giving your brain a break, a chance to reset so you can start actually engaging in therapy and those coping strategies.
Precisely. It's not about masking the problem or relying on medication forever. It's about creating a foundation for healing. And it's so important to remember that finding the right treatment plan, it's a collaborative process.
So, working closely with a mental health professional, being open and honest about what you're experiencing, advocating for your own needs, those are all key parts of that process.
Absolutely. It's about finding what works best for you. And that might mean trying different approaches, maybe tweaking medications, or even exploring alternative therapies. It's a journey, not a destination.
And speaking of journeys, throughout this whole deep dive, we've talked a lot about these individual steps toward well-being. But I keep coming back to this idea of community. The ADAA especially really highlighted how vital social support is. It seems like it's not just about what we do for ourselves, but also those connections we create with others.
You're absolutely right. Humans are social creatures. We crave connection, and those bonds, they're absolutely essential for mental well-being, whether it's close friendships, family, support groups, or even online communities. Having those connections can really protect you from stress and loneliness.
It's like having a safety net, knowing you're not alone in what you're going through, and knowing that you have people to lean on, people who genuinely get it, that can make all the difference.
It really can. And while we're on the topic of reaching out, I think it's important to talk about self-advocacy
Oh, yeah, good point.
because it can be tough, especially when you're just feeling crushed by depression or anxiety, to even think about advocating for yourself.
Right.
It feels almost impossible.
It does. It's like when you're barely functioning, the last thing you want to do is have to fight for your needs.
I understand. But it's crucial to remember that you deserve quality care. And sometimes getting that care means you have to speak up.
So how can we be better self-advocates, especially when it comes to our mental health? Any practical advice?
Well, start by learning about your condition. Educate yourself about the different treatments that are out there.
Okay.
Because the more knowledge you have, the better equipped you'll be to make decisions about your own care.
Knowledge is power, especially when it comes to navigating something as complicated as the healthcare system.
Exactly. And don't be afraid to ask questions during appointments. If something doesn't make sense or you feel uncomfortable with something, just speak up. Doctors and therapists, they're there to help you.
It's about building a partnership, working together to get you to a better place.
Exactly. And remember, it's totally okay to get a second opinion if you want one, or even to try different therapists until you find one that really feels like a good fit for you.
It's your journey, and you have the right to make choices that feel right for you.
I love that. Speaking of feeling good, I think it's important to just acknowledge all the effort you've put into this conversation today. It's not always easy to talk about these things.
You're right, it can be challenging. But we've covered so much. We started by understanding how closely linked depression and anxiety are. Then we really went deep into those treatment options. Everything from therapy and medication to lifestyle changes and the power of community. We even talked about things like gratitude, mindfulness, and spirituality.
It's been an amazing deep dive. I truly hope this has left you feeling more informed, more empowered, and hopeful about the future.
Me too. And as we wrap up our deep dive, I want to leave our listeners with one final thought. If you could go back in time and give just one piece of advice to your younger self about navigating life's challenges and really taking care of your mental well-being, what would you say?
Wow, that's such a thought-provoking question. It really makes you think about all the things you've learned along the way. I think I'd tell my younger self to be kinder to herself, to accept her imperfections, and to remember that asking for help is not a weakness. It's actually a sign of immense strength.
That's such a powerful message. And I think it's the perfect note to end on. Remember, everyone, you are not alone. There are resources available, people who care, and a whole world of possibilities out there waiting for you. Thank you so much for joining us on this deep dive into depression and anxiety. Until next time, take care of yourselves and each other.